All right. We are going to do a respiratory assessment today, and I have my lovely assistant again. Isn't she so cute? All right, so I have my stethoscope, which is what we need. All right, so we are going to do a respiratory assessment. We're going to check you out, make sure your lungs are working good, and you don't have any problems. I hope so too. Just be sure you're nice and still and quiet, and just follow along with what I need you to do. Okay? All right. So first, I'll wash your hands. And I just need to find out a little bit about your history. So just a few questions for you. Do you have any like emphysema or COPD? No, not that you're aware of anyways. Asthma, cystic fibrosis. Ever had any whooping cough? Tuberculosis.
Like Papa whooping coughs?
Stop. No.
Okay.
I said not.
No.
Oh man. Bronchitis or lung cancer, anything of those? What about COVID? Have you had COVID? Yeah, unfortunately so. Hopefully, stop it. We are recording this, remember?
I know.
Okay. Do you smoke or vape?
No.
You better not.
I don't worry. That's gross. I don't want to do that.
What about any medications? Do you use any inhalers or do you use a nebulizer?
Nebulizer?
No? Okay, well, I'm glad that you don't, since you don't know what that is. What about oxygen? Do you use oxygen or essential oils?
I'm using oxygen right now.
I mean, like a nasal cannula, a machine to help to give you oxygen to help you.
I don't think so.
You don't. Well, you don't.
No, I don't.
Are you up to date on all your immunizations?
No, I'll go ask my doctor.
You are. You're good. Do you wear your PPE when you need to?
My mask and my
Yes.
gloves? Of course I do.
Well, your mask, yes, when you're at school to protect you from getting
Yeah, unless the teacher says we can
COVID
take it
again.
off for a break.
yes. Well, what about for a job? Do you work on a farm? Are you a hairstylist? Do you do nails? Anything like that?
I'm my own hairstylist.
You are you?
I don't get paid for it though.
Oh, are you a painter? Are you ever exposed to asbestos?
No.
No? Okay, good. That's a good
I thought you
thing.
were going to say arsenic.
You a plumber? Do you do heating and cooling?
No, I'm
Any
not
of those things?
Mario or Luigi, mother.
Okay, kid. All right. So then, after we go through all that, then we just basically kind of do an overall assessment, a visual assessment. So we're going to inspect the thoracic cavity here. And we're also going to check the face. We're going to check for any nasal flaring when they're breathing. Positioning of how they're sitting, like if they're sitting leaning over trying to breathe. Then a tripod position.
What's a tripod position?
Just like that. You'd be at a table and you'd be like leaning over like this, trying to get your air in better.
Oh.
And we would be like observing the fingers for any clubbing.
Phalanges.
Saley. We'd also be watching for any retraction of the chest, paying attention to the respiratory rate, the depth of the respirations, if they're barrel-chested, anything like that. We would also be observing the skin color and temperature, making
Pale
sure that
and
we're
cold.
making sure they're pink, dry, and warm.
Oh.
Not pale and cold and ashen. We don't want that. That's bad. We'd also check for any anxiety or diaphoresis, level of consciousness. We'd be checking their nail beds. We'd be checking the capillary refill, making sure that it's less than 3 seconds.
Oh, like when they go like this and they go to see the whiteness of
Yes,
that's what they do at the
Yeah.
doctors to
Yeah,
see my blood pressure.
Well, that's not your blood pressure. Capillary refill, my dear.
My oxygen levels?
Kind of, yes.
Cool.
Can we get on with this now?
It's alright.
That's all right. And then we're going to palpate the chest. We're going to check for symmetry. So I'm actually going to have you stand up for me.
I have legs.
You do. And we're going to turn. There we go. No, stay where you are. There we go. And I'm going to put my thumbs about the 10th rib. Feel for your ribs. And on either side of the spine. And take a nice deep breath in and hold it. And we're going to look for like that 1 to 2 centimeters of separation. All right, go ahead and let it go. You're good. And then we're going to also check the tactile fremitus. So I'm going to put my palms on her back, and I'm going to feel and listen for any vibrations. Can you say 99?
99.
So that seems pretty reasonable. If it was an increase in vibration, that may indicate like a dense or inflamed lung tissue, which could be like a tumor or pneumonia. And then also a decrease in air a decrease would be like air or fluid in like the pleural space, which would also indicate like a decrease in tissue density. So like COPD.
Not good.
No, asthma, stuff like that. Then we're going to percuss, which I don't know if we
like
can
a drum percussion.
turn a little bit so we can kind of see here. Yes, and we'll take our 2 fingers.
Ooh,
you okay there?
it felt weird.
And we're gonna tap knuckles, and we're going to if it's like a flat or I can't even speak right now. We're gonna check. We want it to be resonance, which is a normal lung sound, a low pitch lung sound. If it were to be flat, it would be more of a high pitched, which is like soft dense tissue, no air. So that would be like a tumor or an effusion. If it was dull, it'd be like a medium pitch, which would be like a solid or fluid filled area combination. And then resonance is not good either. So that's like a lower pitch than the resonance, which would indicate maybe a hyperinflated lung, asthma, COPD, something like that. And then we need to auscultate our breath sounds.
What does that mean? Auscultate, like Oscar the Grouch?
Listen.
Oh, okay.
Auscultate, listen. So then we'll get my stethoscope on here, and first we're gonna turn back around.
Itchy.
So first we're going to listen for bronchial sounds, and that's going to be kind of next to the trachea. Breathe. And then, so those would be high-pitched, hollow sound, short inspiration, long expiration. And then we listen for breathe for me again. Bronchiovesicular sounds. Oh, my stethoscope. No, it's in the right way. And that way we listen to around the first or second intercostal space. Breathe. Ooh, look at listen to them lungs.
Does it sound bad, doctor?
No, they don't. So that would also be short inspiration, long expiration. And then vesicular sounds, those would be throughout the lungs, and those are typically low pitched, long inspiration, short expiration. And then we're going to turn you around because we're going to listen to your lungs, and we are going to want to do kind of like a zigzag pattern because we're going to want to check both sides equally. Maybe we should turn this a little bit. I don't know. Maybe that would be better. Stop. We want to make sure we're comparing each side equally, so we're going to kind of do that zigzag pattern as we go.
Turn back this way so you can see the camera.
What?
Should I turn my back this way so that my back can see the camera better?
I think we're okay. Just stand for me, okay?
All right.
Take a nice deep breath in through your mouth, or in through your nose, out through your mouth. Take another nice deep breath for me. And another one. And another. Keep going. Okay. Good. You can sit down now, ma'am.
Yay.
We would be listening for crackles in the lungs, which would be kind of, you'd hear those on the end of inspiration, and they're going to be kind of wet and crackly, poppy, and that would indicate like if there's fluid and stuff in the lungs. And then we'd be listening through rhonchi, which is heard kind of throughout the lung. Like a continuous snoring sound that's lots of fluid, so more fluid than what your crackles would be. Wheezes would be like a high-pitched, the closing of the airway. It's usually continuous on inhalation and exhalation, usually with like asthma, stuff like that. And then what else? Stridor. It's kind of like wheezes, but it's high-pitched on inspiration. That could be like an obstruction, croup, something like that. And then we have bronchophony. So we would actually, I should have had her say, here, stand up. Because we're going to say, I'm going to have you say, I'm going to listen here and have you say the letter E.
E.
And that's good, because that sounds like the letter E. If it would be bad if it...
Sound like the letter
A. Correct. Very good, very good, very good.
I was just guessing.
Very good, young grasshopper. Very good.
I am a grasshopper. Cricket.
You are quite the grasshopper. And then let's see, a pleural rub, and that's like when kind of sounds like a balloons rubbing together or grating. And that could be from like an abscess or pleurisy, something like that. Diminished or absent sounds obviously would not be good either. Basically, it's just what it says. They're very hard to hear. You don't hear very much noise.
They're not there.
Or they're not there. You can't hear them. Did I get them all?
What about itchy legs? Does it have anything to do with your breathing?
Stop it. Stop with your itchy legs.
Molly scratched me.
Okay, stop.
Okay.
And that actually I think is about it. So thank you to my lovely assistant here.
Very healthy, not anything bad happening child.
Yes, good thing that COVID did not affect your lungs negatively. They sound wonderful. Thank you for coming.
Coronavirus!
Stop.